Thank you, Doris. I'm so proud to be here today representing the voices of primary care nurses in Ontario. I can honestly say that the nurses who work in this specialty have been waiting for this day for years. As primary care nurses, we are simply thrilled that our professional association, RNAO, is placing our role front and center as a solution to system challenges. Some of us have been working for many years and are now closer to the end of our careers. This report and its recommendations are not only an acknowledgement of our expertise, but also an urgent call to action. This report validates what I and my colleagues have known all along. We're ready, willing, and eager to work to our full scope of practice and do even more as our report recommends. As you've heard today, we're the first point of care for people who require health care. Many people in Ontario do not even have a primary care provider, which is why our expertise is all the more important. We have the ability to provide our patients with immediate improved access and better care coordination. Our goal is to have every RN and RPN reach the top of their competencies by using their knowledge and skills to the fullest. Within the next 3 years, we want to see that RNs in primary care are placing a strong focus on health promotion and disease prevention activities with people of all ages, especially with children and older persons. We want to see them performing and interpreting comprehensive health assessments for our patients and identifying and prioritizing interventions. We want to see them providing an array of clinical procedures and treatments, such as attending to persons with otitis media, sore throats, vaginal discharge, and we want to see them coordinating care. We also want to see an increased role for RPNs, for example, leading wound care clinics, leading vaccination programs, educating clients to prevent chronic care conditions such as diabetes, asthma, and others, as well as helping them to manage these conditions to prevent complications. Unfortunately, too many of us are spending a lot of time putting patients in rooms and doing vital signs. We know we are capable of much more and deserve the opportunity to do so. More importantly, the Ontarians need us to do so. Some RNs have been very proactive about the contribution they make, and they can serve as mentors for others who have been stifled by their work environment. The recommendations we have unveiled today will go a long way toward reassuring these and all primary care nurses that they have a key role in healthcare and that their contribution is essential. In the healthcare world, we spend a lot of time talking about collaboration and about being part of interprofessional teams, but the reality is that there are perceptions about what primary care nurses can do and should be doing, and the status quo is no longer good for us. We want to see a greater emphasis on collaborative practice, where primary care nurses play a leadership role in patient care and program design. Nurses have a great deal of education and experience, and their contribution must be fully embraced. We can do a better job of understanding our respective roles and what each healthcare professional brings to the patient experience. The changes we're recommending are long overdue and a welcome challenge for the nurses, primary care nurses across the province. They will empower primary care nurses, they will improve the recruitment and retention of nurses to this sector, and that is essential if we want to make sure we have enough nurses to meet the care needs of the people of Ontario. The true benefits of our health system can only be realized when all of its nurses practice to the full scope of their competencies, knowledge, skills, and experience.